Welcome to the final module of the INSTI HIV-1, HIV-2 Antibody Test Masterclass. This course has covered HIV pathophysiology and immunology, the components and technology of the INSTI test, how to perform the complete testing procedure for both patient and control samples, and finally, how to implement rigorous quality control systems. This module focuses on troubleshooting. Unexpected test issues can occur even with experienced testers, and when procedures are followed correctly. The ability to systematically identify problems, determine their root causes, and implement effective solutions is a cornerstone of consistent and reliable testing programs. This module guides you through troubleshooting scenarios and examines patterns that may indicate systemic issues. We will review problem-solving frameworks that can be applied to any situation and discuss how to document troubleshooting experiences. Let's begin. Effective troubleshooting is a structured process rather than trial and error. A systematic approach narrows down possibilities when addressing testing issues, helping identify the root cause. Let's establish a framework that can be applied to any testing issue. Step 1 is to define the problem clearly. General statements such as, "The test did not work," are not specific enough. Identify whether the issue involves an invalid result, an unexpected result pattern, flow timing, or another observable concern. Step number 2 is to gather relevant information. This includes when the issue began, whether it occurs consistently or intermittently, and whether it is associated with a specific operator, kit lot, testing environment, or sample type. Information is the foundation of effective troubleshooting. Step number 3 is to consider possible causes based on the information collected. These may include operator technique, sample quality, kit storage, environmental factors, or equipment malfunction. Step number 4 is to test possible causes systematically. Start with the most likely causes or the easiest to test. Change should be made one variable at a time to identify the factor that resolves the issue. Step number 5 is to implement and verify the solution. Once the cause of the issue is identified, verify that the solution has resolved the issue. Run control samples, perform test validation, and monitor results to ensure the issue does not recur. Step number 6 is documentation. Record the issue, its cause, and the resolution. This supports future troubleshooting if similar issues arise again. It also contributes to knowledge that improves overall testing and quality programs. This section focuses on environmental and storage issues, which can affect test performance in less obvious ways. These issues often present as patterns across multiple tests rather than isolated incidents. Here's a scenario. Over the past week, flow times have been progressively slower. Solutions that normally absorb in 20 to 30 seconds are now taking 60 to 90 seconds or longer. Here are some possible causes to consider. First, check environmental conditions. High humidity can significantly affect membrane performance. Humidity above 45 to 50% can cause membranes to absorb moisture from the air, changing their flow characteristics. Check facility humidity levels and consider the use of a dehumidifier in the testing area. Second, review temperature conditions. While the INSTI test has a broad acceptable temperature range, testing at extremes, especially below 15 degrees Celsius, may slow flow rates. Temperature conditions in the testing area should be verified. Third, investigate storage conditions. Test kits stored outside the recommended 2 to 30 degrees Celsius temperature range, particularly when exposed to temperatures above 30 degrees Celsius for prolonged periods, may exhibit changes in membrane characteristics. Review storage logs and verify refrigerator and storage area temperatures. Fourth, consider kit age. While kits remain valid until their expiration date, some conditions may affect kit condition. This includes kits near the expiration date that were stored at the higher end of the temperature range. To verify, perform a test using kits from a more recently manufactured lot. If environmental factors and storage conditions appear appropriate, control samples can be run to determine whether the issue is related to the kit or with the broader testing process. If controls flow as expected while patient samples flow slowly, the issue may be sample related rather than kit related. Sample quality and characteristics can affect test performance. This section reviews common sample-related issues and how to identify them. Here's a scenario. A patient's test shows prolonged flow times, and a faint ring appears around the test spot area after all solutions are added. The control dot is present, but the test spot's appearance is ambiguous. What's happening? This pattern suggests a sample with unusual or atypical cellular characteristics. Certain conditions can affect how blood flows through the membrane. These include elevated hemoglobin levels, increased blood viscosity, or cellular abnormalities. The presence of the control dot confirms adequate samples added, but flow characteristics are affected. This specific pattern with the faint ring is classified as an indeterminate result. Do not interpret it as positive or negative. Draw a venous blood sample and send it for confirmatory laboratory testing. Document the appearance clearly, noting the flow time and the specific appearance at the test spot. Here's another scenario. Multiple patients tested on the same day all show faint control dots that are barely visible. Test spots on known positive controls also appear fainter than usual. What could be causing uniform faintness across multiple samples? This pattern suggests a potential issue with solution 2, the color developer. First, verify that solution 2 was inverted properly before use for each test. Settled dye is the most common cause for uniformly faint results. Second, verify the expiration date and storage conditions of solution 2. If solution 2 has been exposed to extreme temperatures or is expired, the dye may have degraded. Third, verify that solution 2 has completely dispensed into the membrane during testing process. Remember, incomplete addition could result in weaker color development. Run fresh control samples with a new test kit and ensure thorough mixing of solution 2. If control dot intensity returns to expected levels, the cause has been identified. If problems persist with correct handling and new kits, contact technical support. Operator technique is a common source of variability. Even experienced operators can develop subtle technique variations that can affect results. This section reviews how to identify and correct technique-related issues. Here is a scenario. One operator has a higher invalid test rate than others, approximately 5% compared to the facility average of less than 1%. The operator consistently gets valid results with control samples, but has frequent invalids with patient fingerstick blood. Let's discuss what could cause this issue. This pattern suggests insufficient blood collection. Observation of fingerstick collection technique may help identify contributing factors. This includes pipette orientation. Assess if the pipette is held horizontally or at an angle. Next, confirm if the vent hole is covered during collection. Finally, check whether the blood is allowed to fill automatically to the line or whether the blood collection is stopping early. In some cases, slightly less than 50 microliters may be collected without being apparent. Blood may briefly reach the line without completely filling the capillary. This reduced volume, although small, may contribute to invalid results, particularly when blood flow is limited. The corrective action includes retraining, focus on blood collection technique. Emphasize proper pipette positioning, keeping the vent hole uncovered, and allowing complete automatic filling to the marked line. Operators should practice using control samples under observation to ensure proper technique before returning to patient testing. Here is another scenario. One operator consistently reports that solution 2 does not appear to flow through completely and appears to hang up on the membrane, taking longer than expected to absorb. Other operators using tests from the same lot do not report this issue. Observe the operator handling solution 2 to help identify the cause. Inadequate inversion before use may result in uneven dye distribution. Rapid or forceful pouring may temporarily overwhelm membrane absorption. Reaffirm with the operator that before use, solution 2 should be inverted 4 times until uniformly blue. Then pour it at a steady, controlled pace into the center of the well. Result interpretation challenges may occur when the test appearance does not match textbook examples. Understanding the range of normal variation will help develop confidence in interpreting ambiguous results. Here's a scenario. After adding solution 3, a clear control dot is visible at the 12 o'clock position. At the 6 o'clock position, there is a very faint blue coloration that is more intense than the surrounding membrane, but does not form a distinct dot. Is this reactive or non-reactive? First, consider the lighting. The membrane should be viewed in a well-lit area from directly above. Tilting the membrane or viewing at an angle can create optical effects that do not represent true reactions. Color should be assessed under bright, direct overhead lighting. Second, compare the test spot area to other areas of the membrane. Localized color at the test spot in the 6 o'clock position should be distinguished from general background staining. True reactions show localized color at the specific test spot location. Third, consider the timing. Results should be read within 5 minutes of adding solution 3 and while the membrane is still wet. After this time, background staining can reappear as the membrane dries, which can create misleading appearances and false impressions of reactions. The guiding principle is that any localized blue color at the test spot that is clearly distinguishable from the background should be interpreted as reactive results and referred for confirmatory testing. Any localized blue coloration at the test spot that is discernible from the background, even if faint, should be treated as a preliminary reactive result and sent for confirmatory testing. Here's another scenario. The test spot appears as a blue ring rather than a solid dot. The control dot is present and normal. Is this reactive? Yes. A ring is a valid reactive pattern. Antibody and antigen reactions do not always produce perfectly uniform solid dots. The spot appearance can vary based on antibody concentration, flow dynamics, and membrane characteristics. And a blue marking at the test spot location, whether solid, shaded, or ring-shaped indicates antibodies were captured, and the result should be interpreted as reactive. Although the INSTI test requires minimal equipment, issues with pipettes, storage equipment, or test materials can affect performance. This section reviews equipment-related troubleshooting. Here's a scenario. During testing of venous plasma samples, control samples occasionally produce invalid results with no visible control dot. Fingerstick blood testing proceeds normally. What could be causing this discrepancy? The most likely cause is pipetting accuracy. When testing venous samples, plasma, serum, or controls, a calibrated precision pipette must be used. The capillary pipette should never be used for control testing. If the precision pipette is out of calibration, less than 50 microliters may be delivered. Check pipette calibration using gravimetric analysis or a calibrated reference. Water at room temperature should weigh approximately 50 milligrams for a 50 microliter volume. Delivery outside a range of less than 45 microliters or more than 55 microliters indicates that calibration or replacement is required. Also verify pipetting technique. Sample collection using the calibrated pipette should be performed, ensuring the plunger is depressed to the first stop rather than the second stop. Adequate time should be allowed for sample uptake into the tip. Confirm that the correct pipette tips are used. Here's another scenario. Multiple test kits from the same lot show damaged membranes, including tears, holes, or visible defects in the membrane surface. What steps should be taken? Do not use kits with damaged membranes. Membrane integrity is essential for proper test function. Document the issue thoroughly. Record the kit lot numbers affected, the number of damaged kits, and photograph the defects if possible. Contact bioLytical technical support immediately at customercare@biolytical.com or call us at 1-866-674-6784. Report the lot numbers affected and the nature of the defects. Do not use any remaining kits from the affected lot until technical support advises. bioLytical will investigate and provide replacement kits if a manufacturing defect is confirmed. In some cases, individual test issues reflect broader systematic problems. Learning to recognize patterns helps identify and address root causes rather than addressing isolated issues. This section reviews scenarios addressing different program patterns and trends. Here's a pattern. The invalid test rate suddenly increases from less than 1% to 5 to 10% over a few days, affecting multiple operators. What does this pattern suggest? A sudden increase affecting multiple operators suggests an environmental or kit-related issue rather than operator technique. Check storage conditions, including potential refrigeration failures or exposure to temperature extremes. Environmental conditions such as humidity changes related to weather or HVAC function should also be assessed. Run control samples using multiple kit lots. If some lots produce valid control results while others do not, affected lots have been identified. If all kit lots produce invalid control results, the issue is environmental or procedural. Here's another pattern. All tests performed on a particular day show longer flow times than usual, but produce valid results. The next day, flow times return to normal. What could explain this transient issue? This pattern suggests temporary environmental conditions. Possible factors include increased humidity related to weather, lower room temperature due to HVAC issues, or sample-related characteristics associated with the patient population tested on that day. Document the incident. If it does not recur, no action is needed beyond documentation. If it recurs regularly, investigate the specific environmental factors associated with these incidences. Here is an additional pattern. One specific operator consistently produces reactive results on samples that other operators test as non-reactive, or vice versa. What does this suggest? This pattern indicates an interpretation issue specific to that operator rather than a technical issue. The operator may be applying different criteria for what constitutes a visible dot. This requires retraining on results interpretation using comparisons of various result appearances. Review results interpretation using side-by-side comparison, control samples, and blind testing to calibrate the operator's interpretation. Provide reference images showing the range of acceptable reactive and non-reactive results to allow the operator to interpret the results and compare interpretations to the supplied references. Certain patient populations or clinical situations may present unique testing challenges. Understanding these special cases help recognize unusual or unexpected results. Here's a situation. A patient with multiple myeloma has an invalid test. No control dot appears despite adequate blood collection. Repeat testing produces the same result. Why might this occur? Multiple myeloma and other conditions associated with severe hypogammaglobulinemia can result in extremely low IgG levels. The control spot requires adequate IgG to produce a visible dot. In patients with severely depleted IgG, the control dot may not appear, though the test was performed correctly. This is a recognized limitation documented in the instructions for use. For these patients, the INSTI test may not be suitable. Alternative testing methods do not rely on IgG controls should be used. Document the patient's medical condition and the rationale for using alternative testing. Here's another situation. A patient known to be on antiretroviral therapy for years tests non-reactive with INSTI. The patient's medical records confirm HIV diagnosis and viral suppression on treatment. Is this a false negative? Potentially yes. Long-term antiretroviral therapy can suppress viral replication to such low levels that antibody production decreases over time. Some patients on successful long-term treatment may have declining antibody titers that fall below detection thresholds. This is another documented limitation. For patients with known HIV on long-term ART, the INSTI test result should be interpreted in the context of their medical history. Don't rely solely on the antibody test to determine HIV status in these individuals. Refer to their medical records and their known HIV diagnosis. Here's an additional situation. A patient presents as a possible elite controller, infected with HIV for years, but maintaining undetectable viral loads without treatment. They test non-reactive with INSTI. Could this be accurate? Elite controllers represent a very small percentage of HIV-infected individuals who naturally suppress viral replication without medication. Some elite controllers may have very low antibody levels that could potentially produce negative results on antibody tests. However, most elite controllers do produce detectable antibodies. If clinical suspicion is high based on exposure history and other factors, additional testing with alternative methods is warranted. Do not assume the negative result is accurate when clinical context suggests otherwise. In some situations, troubleshooting may require support beyond the testing site. Knowing when and how to contact technical support ensures you get assistance efficiently. Contact technical support when you encounter repeated invalid results with control samples despite proper technique and storage. When multiple kits from the same lot show consistent abnormal performance, when damaged or defective test components are discovered, or when you've exhausted the troubleshooting steps without resolving the issue. When contacting technical support, prepare comprehensive information, lot numbers of all kits involved, expiration dates, description of the problem with specific details about appearance and patterns, storage conditions, and any temperature excursions, troubleshooting steps you've already taken, and results of control testing if performed. Photographs are extremely useful. If you're seeing unusual appearances on the membrane or defects in the components, photograph them and send the images with the technical support request. Visual information helps technical support staff understand the issue much quicker. Response times are typically rapid, often within the same business day. Technical support staff can advise on whether issues represent normal variation, help identify root causes, and arrange for replacement materials if defects are confirmed. Every troubleshooting experience is an opportunity to improve testing programs and prevent future issues. This section reviews how to document and apply lessons learned. Create a troubleshooting log separate from routine quality control documentation. When issues occur, record the problem, the investigation steps taken, the identified root cause, the solution implemented, and the outcome. This log is a valuable reference for future troubleshooting. Share troubleshooting experiences during staff meeting or training sessions. Discussing cases as a team supports consistency and builds collective expertise. Shared experiences may assist others if similar issues arise. Troubleshooting records can be reviewed to identify improvement opportunities. Recurring issues may indicate a need for additional training, procedural adjustments, or changes to storage or environmental conditions. Periodic review of troubleshooting records, such as quarterly or annually, can help identify trends over time. Patterns related to seasonal conditions, specific lots, or recurring challenges may highlight areas for systematic improvements. Troubleshooting expertise develops over time through experience and deliberate practice. This section reviews practical ways to build troubleshooting skills. First, a thorough understanding of normal test appearances is necessary to recognize abnormal results. Study examples of typical reactive, non-reactive, and invalid results, as well as acceptable variation in dot intensity and appearance. Second, practice systematic thinking and work through the troubleshooting framework. Define the problem, gather information, identify possible causes, test systematically, implement and verify the solution, and document outcomes. Third, exposure to a range of testing situations supports more comprehensive troubleshooting frameworks. Reviewing issues encountered across different settings, such as low and high volume settings, can yield ideas for improvement. Learn from colleagues' experiences at different sites to expand knowledge and familiarity with less common scenarios. Challenging situations may arise during testing and troubleshooting. Reviewing these situations and the steps taken to resolve them can help the team develop further expertise. Fifth, know where all the resources are. Keep the instructions for use readily available. Maintain contact information for technical support. Save useful troubleshooting resources and reference materials. It is not necessary to memorize everything, but it is important to know where to find information when needed. This concludes the technical modules of the INSTI HIV-1, HIV-2 Antibody Test Masterclass. This section reviews how all these elements integrate into professional practice and ongoing development. The content in this course covered HIV pathophysiology, immunology, test technology, procedural technique, quality control systems, and troubleshooting expertise. Each element is interconnected. Understanding the underlying science supports correct procedure. Quality control maintains standards and supports reliable results. And troubleshooting skills supports consistent testing practice. Knowledge supports testing, but deliberate practice and ongoing learning are also required. Continued attention to technique, quality processes, and result interpretation supports skill development and deepens understanding of HIV testing. Stay current with developments in HIV testing and care. Attend continuing education opportunities. Read updated guidance from public health authorities. Participate in professional networks where there are opportunities to share experiences and learn from peers. Remember that HIV testing is more than a technical procedure. It occurs within a patient care context. Every test performed serves a person who deserves compassion and diligence. Technical competence, attention to quality, and problem-solving skills directly contribute to patient care and public health. The INSTI test rapid results help eliminate lost to follow-up cases and provide opportunities for immediate counseling and linkage to care. Rapid testing's role in providing rapid, accurate results is essential to achieving HIV public health goals, such as increasing diagnosis rates, connecting more people to treatment, preventing onward transmission, and ultimately reducing HIV rates worldwide. Congratulations on completing all 5 modules of the INSTI HIV-1, HIV-2 Antibody Test Masterclass. Completion of this course demonstrates a commitment to professional development and to providing reliable HIV testing. This course has provided a comprehensive foundation in HIV testing using the INSTI platform. Topics include learning more about the pathophysiology of HIV infection and immunology principles underlying antibody detection. This course also covered the technology behind the INSTI tests and components, the complete testing procedure for various sample types, quality control principles and how to implement them, and troubleshooting skills to identify and resolve problems systematically. The knowledge and skills covered in this course support accurate and consistent use of the INSTI HIV-1, HIV-2 antibody test. This training also supports collaboration with colleagues, contributes to quality improvement initiatives, and integrates INSTI into testing programs and care processes. To receive official certification from bioLytical laboratories, a final assessment must be completed. This comprehensive assessment will evaluate knowledge across all 5 modules and verify readiness to perform the INSTI HIV-1, HIV-2 antibody test in clinical practice and test settings. The assessment includes multiple choice questions covering HIV fundamentals, test components and technology, procedural technique, quality control, troubleshooting, and clinical applications. A score of 80% or higher is required to pass the course and receive certification. Once the assessment is successfully completed, your official certificate will be sent to the email address used to register for this course. Please allow up to 24 hours for certificate delivery. If you don't see your certificate in the inbox, please check your spam or junk folder. Sometimes automated emails are filtered there. Your certificate validates your proficiency in administering the INSTI HIV-1, HIV-2 antibody test. Make sure to add the certification to your professional credentials and include it on your LinkedIn profile to showcase your specialized expertise in rapid HIV testing. Thank you for your commitment to providing quality HIV testing. Your work makes a difference in the lives of individuals and communities impacted by HIV. Best wishes as you apply your new expertise in clinical practice, and congratulations on completing the INSTI HIV-1, HIV-2 antibody test Masterclass.